Hello, welcome to the COVID Ethics Update. I'm Terry Rosell, the Rosemary Flanagan Chair at the Center for Practical Bioethics. Joining me on this update is my colleague, Ryan Pferdehirt, who works with me at the center. Today, we're going to talk about ethics issues that are rising in our regional hospitals here as the coronavirus pandemic ramps up. So Ryan, you are doing quite a lot of ethics consultation with several regional hospitals and health systems without disclosing any confidentialities, of course.
Right.
What are you hearing and seeing of ethics relevance as the COVID-19 pandemic is ramping up?
I think the main thing that I'm seeing right now is the proactive approach of a lot of our hospitals right now of we're taking the valuable lessons that we're seeing because it hasn't really hit here as hard as it has hit in other areas, so Seattle, New York, California, and Florida. We're seeing the lessons from those states and their responses and preparing ourselves right now. I've been in a lot of meetings talking with a lot of system level and also physicians. They're saying, we're good right now. We've had, on average, I'm hearing about maybe 3 or 4 patients who they believe, because we don't have tests, so we're not even sure if they're positive. We're just strong suspicion, but we're not getting overwhelmed right now, but we're expecting to be overwhelmed. So all of the work right now is on preparation for when the storm hits. And I think that's
so it's sort of like the calm before the storm, or
yes.
as someone, maybe it was you, said, it's sort of like standing on the beach. The earthquake has happened somewhere out there. The tsunami is coming, but we're still on the beach awaiting the wave.
Right. That's exactly where we are right now. And it's this unsettling feeling of the expectation of it coming. And then there's also the double-edged sword of, if it doesn't hit, was all of our preparation unnecessary, or did we do the right job by preparing for something that never actually came? But I feel like we're really strong right now in terms of nobody's scared, nobody's nervous, everyone's just anxious to make sure we can deliver the care that we want to care. So we're making sure we did our preps. We have our resources ready to go. We have our processes ready to go so that when it hits, because everyone's expecting it to hit, we're ready to go and we're ready to deliver care. We don't want to take a moment to step back and think, what are we doing? What do we need to do? We're doing that already right now. And we're taking the lessons that we learned from the other systems and using that to our advantage of, we're seeing what worked, we're seeing what didn't work, and we're getting ready for it. And I'm really not surprised, but encouraged by that level of proactive steps being taken across all hospital systems and all forms, from C-suite all the way down to the individual staffs. There is a gung-ho-ness, a ready to go. We want to be able to do our part and participate in this. And that's really encouraging to see.
Okay, so when you say everybody, you're referring to the everybody that you're in touch with in some of our regional hospitals.
Yes. There is a little
because
bit.
Everybody out there on
yes.
social media and maybe in our neighborhoods and our extended families seem to be pretty scared, if not panicked.
Right. The non-healthcare individuals out there are pretty nervous and pretty scared, and seeing even the people who don't necessarily are the biggest supporters of it are seeing like, wow, this is real. This is really hitting. These types of precautions and the shutdowns, like, we wouldn't just be doing this. We're seeing the effects of the required steps to take, and by the extreme of shutting down the country, basically shutting down the economy, we don't just do that. So it's kind of adding some credibility to the larger scale of this pandemic. But in terms of healthcare workers, everyone's ready to go. The only hesitancy that I've been seeing is there is some fear about not having enough protective equipment for people who may not be determined to be requiring of the protective equipment. So while physicians and nurses are all expected to be ready to go with masks, the frontline people, admitting staff at the ED or social workers or janitory staff, every one of them are saying, are we going to have enough for us to be able to be protectively covered? And there is a little bit of concern in terms of how are we going to be allocating the resources? Do we have enough resources? And we feel like we're ready right now. We feel like we're going to be able to do a good job, but until it actually hits and until we're in it, we're not really sure. And we feel like there's going to be some situations and some challenges that are going to come up that while we're doing a good job planning, a great strategy do a sports analogy, you could have the best game plan, but every game plan goes out when you get punched in the mouth. So when the hospitals get punched, is the game plan still going to be the same game plan?
And let's acknowledge again that we're talking about regional hospitals here in the heartland.
Yes.
Not just greater Kansas City, but nearby. And we don't know who might be listening to this podcast. It could be in other parts of the world or other parts of the United States. And we acknowledge that our colleagues and family members may be in very, very different circumstances there. In fact, we're reading some pleas for help from coastal hospitals where they are running short or are close to running short of critical supplies.
And that's what a lot of our work recently has been on, working with a lot of organizations on establishing like protocols and standards, but then also allowing them to be malleable enough that every health system can be expected to participate to the level that they're able to participate. We don't want to set standards of everyone being a level 1 trauma center where not everyone who's going to be seeing these patients are going to be at that level of resources or capability. So we want to make sure that everyone's able to contribute how they can. And I think that's one of the bigger things that we're seeing with this pandemic is we talk about how polarized and isolated and separated we are as a nation, but now we're seeing that one thing can hit all of us and we're all wanting to do what we can to contribute back and help each other out, but not everyone's able to contribute to the same level as others. And it's a lot of understanding what you can do and do your part, but don't be expected to do more than what your part actually should be.
Also, as we come to wrap up this brief update, there may be some listeners who are in hospitals where they don't believe or don't feel that they are prepared or are engaging in the right sort of preparations or conversations. What would you have to say to them?
These are trying times, and they're putting our systems and our strategies in to the fullest extent possible. We are doing what we can, but it's showing that while we were not necessarily as prepared as we wanted to be, and it's showing we are all caring people. We're all working. We all went into healthcare to help people, but we can only be expected to do what we can. We were talking recently about virtue ethics. You want to be a virtuous person, and I think that everyone in healthcare strives to be a virtuous person. But a virtue is the middle ground between two vices. You don't want to be a fool, and you don't want to be a coward. You don't want to rush into a situation that you know you're going to harm yourself, but you don't want to be a coward and run away from it. So I feel like everyone in healthcare is a virtuous person of we want to do what we can, but we want to make sure we have our proper safety measures in place so that we are able to do what we can. So we want to stay in that middle ground of the virtue of bravery.
And is the Center for Practical Bioethics, in your opinion, poised to be of help to maybe especially those listeners who think that they need some help or their hospital needs some help, their health system needs some help in this time of preparations?
I think that one of the best things about the Center for Practical Bioethics is we have all of our employees coming from such different backgrounds that nobody shares essentially the same background. And that allows us to all approach it from different things. And we're always learning from each other, but we always have a lot of different ways to tackle these issues. And if someone were to reach out to the center, we would be able to have someone who would be able to specialize in the issue that they're struggling with and not be fitting square pegs into round holes. And I think that's where the major value of our organization is.
And we have some resources that can be accessed free of charge, practicalbioethics.org, practicalbioethics.org. Thank you, Ryan.
Thank you,
Thanks
Terry.
for all of you who have tuned in to the COVID Ethics Update from the Center for Practical Bioethics. Until next time, this is Terry Rosell and Ryan Pferdehirt. Goodbye.
Thank you.